Hello, my name is Dr. Min. So let's continue with the lecture on the peritoneum. So I'll continue from where we had reached. So we have bare areas of organs that usually are not covered by visceral peritoneum. Remember, we said the organs are usually covered by peritoneum, but not completely. So those areas that are not covered by visceral peritoneum are what you call bare areas, and they allow neurovascular structures to enter or leave the organs. Yeah. So usually they are actually attached to the attachments of, they're related to the attachments of the peritoneal formations. So for example, this shows you the bare area of the liver not covered by ventral mesentery. So peritoneal folds. We have what you call peritoneal folds that are reflection of the peritoneum. So what do you mean by reflection of peritoneum? It's raised from the body wall because of neurovascular structures. Good example is medial and lateral umbilical folds on the anterolateral abdominal wall. The medial and lateral umbilical folds are formed by neurovascular structures. So you can see the medial fold is when peritoneum overlies it forms medial umbilical ligament. So when peritoneum overlies the fetal umbilical artery, where the umbilical artery existed in the fetus. Yeah, remember it obliterated and formed, persisted as medial umbilical ligament. Then the lateral umbilical fold is when peritoneum overlies the inferior epigastric artery and vein. So that forms the lateral umbilical fold. Median umbilical fold is when peritoneum is overlying the fetal urachus. So median umbilical fold, peritoneum overlying median umbilical ligament, which is a remnant of fetal urachus. So basically, that's it about the peritoneal folds. So some folds actually contain blood vessels. So of course, if you cut, they will bleed, like the lateral umbilical fold containing the inferior epigastric arteries. Then we have peritoneal recesses or foci. So recess is just a pouch. So pouch of peritoneum formed by the peritoneal fold. For example, you have inferior recess of omental bursa between the layers of greater omentum. Then we also have supravesical or umbilical fossa between the umbilical folds. So between the umbilical folds here, you have supravesical. This is the urinary bladder. This is the urachus that used to connect the bladder to anterior abdominal wall, but now it's degenerated, and the remnant is what we are calling the median umbilical ligament. So these are the fossa in between the umbilical folds. So this is the lesser sac. So if you're to look at your peritoneum and its recesses, this is the lesser sac. And the lesser sac, above it, there is the upper recess, which is the hepatic recess. This one. And there is a lower recess here, which is the omental recess. Here is the lower recess. So the opening of the lesser sac is usually the epiploic foramen. As you can see, this is the epiploic foramen entering the lesser sac, and above the lesser sac is actually a potential space. So recess is just a pouch from the space, like an external or a side extension of the space. So a side extension of the lesser sac superiorly forms hepatic recess towards the liver. Towards the spleen, you form a splenic recess. Below, towards the omentum, you form an omental recess. So after rotation, remember the stomach, the way it develops, there's usually rotation of the greater curvature of the stomach. So when the greater curvature of the stomach now rotates, the peritoneal cavity is now divided into two, the greater and lesser peritoneal sacs. So the greater sac is actually larger, and the lesser sac, which is also called the omental bursa, lies posterior to the stomach and the lesser omentum. So the greater sac is the main one. Then the omental bursa or the lesser sac is posterior to the stomach and the lesser omentum. So we have what you call the mesentery of the transverse colon, which is the transverse mesocolon. It divides the abdomen into two. Above the colon will be supracolic compartment, and below is infracolic. So supracolic contains stomach, liver, spleen. Infracolic compartment contains small intestines, ascending and descending colon. So this infracolic compartment actually lies posterior to the greater omentum. So the mesentery of the small intestine divides this infracolic compartment into right and left infracolic spaces. Okay. So this is what we are discussing here. You can appreciate this is your lesser omentum, this is the liver, and this is the greater omentum. So above the transverse colon is supracolic. Below is infracolic compartment. This is the transverse colon, and this is the lesser sac. Remember, we said lesser sac is behind the stomach and the lesser omentum. So this is your lesser sac, and the opening of the lesser sac is the epiploic foramen. So this is your stomach, lesser sac here, lesser omentum. So this is supracolic, this is infracolic. So this is the greater sac. All this is greater sac, greater omentum. So we say the greater sac is the larger part of the peritoneal cavity. So all this is greater sac, lesser sac is this one here. So usually, you have communication between supracolic and infracolic compartments through paracolic gutters. These are gutters or grooves parallel to the ascending and descending colon. So these paracolic gutters, this is what I mean by paracolic gutters, gutters or grooves on the side of the colon. So you can see paracolic gutters here. So you can have spread of infection. So you have these spaces, peritoneal spaces, subphrenic below the diaphragm. You have subhepatic, okay, below the liver. This subphrenic on the right and on the left because the two sides are separated by falciform ligament that attaches on anterior abdominal wall. So you have subphrenic space, you have right subhepatic space, then you have paracolic gutters here. You have lesser sac, okay, behind the lesser omentum. Then you have subinfracolic compartment divided into two, right and left, by the mesentery of the small intestine. Then the transverse colon divides the peritoneal cavity into supracolic and infracolic. So now, after understanding what paracolic gutters are, you can have, when fluid is in the peritoneum, it can spread through the whole place, the spaces and the recesses and the gutters, yeah? So you tend to easily spread peritoneal infection. So if you have pus in the abdomen, which is purulent material, it can move from abdomen to the pelvis through the paracolic gutters. And then infection in the pelvis can also go superiorly up to the subphrenic recess. So you'll find somebody who has had pelvic inflammatory disease infection there, then suddenly there's pus accumulation below the diaphragm. So that's why you need to understand that there's communication between abdominal cavity and pelvic cavity through these paracolic gutters. So the gutters also spread tumor. So you can have a tumor of the liver and then it gets to spread all the way down through the peritoneal cavity. So you have peritoneal pathway of metastasis, okay? So we have what we call the omental bursa. We say the omental bursa is the lesser sac. So it's a sac-like cavity lying posterior to the stomach and the lesser omentum. Lies posterior to the stomach and the lesser omentum, and it has recesses, which I showed you, a superior recess. We said it's a space, so part of the space, portion of it moves superiorly, so that's the superior recess. So it's limited superiorly by the diaphragm and the coronary ligaments of the liver. Then we have also inferior recess, and this is between the superior part of the greater omentum. And this inferior recess has anterior and posterior walls of the omental bursa actually sliding over each other. So what's the function of the omental bursa? Actually permits free movement of the stomach and other structures. Yeah, remember, the bursa is just a cavity, and this cavity allows its walls to move freely over each other. That way, there is free movement of the structures around, so as peristalsis goes on. So this space has an extension superiorly as a superior recess and inferiorly as an inferior recess. So this is your omental bursa, which is lesser sac, okay? This is in an infant, this is in an adult, so this is your lesser sac, this is greater sac, and you can appreciate the stomach here, okay? This is the stomach, this is the liver, this is the duodenum, okay? And your pancreas is here. So epiploic foramen. Epiploic foramen of Wislow or omental foramen is posterior to the free edge of the lesser omentum. And the free edge of the lesser omentum is a hepatoduodenal ligament, which I showed you containing the triad, portal triad. So epiploic foramen is posterior to this hepatoduodenal ligament. It allows communication between lesser sac and greater sac. Lesser sac is the omental bursa. So epiploic foramen allows communication between the two. So how do you locate the epiploic foramen? You just run a finger behind along the gallbladder. Then you feel the free edge of the lesser omentum, which is the hepatoduodenal ligament. So the foramen actually allows 2 fingers. What are the boundaries of the omental foramen? Yeah. So this is the omental foramen. You put your finger at the free edge of the hepatoduodenal of the lesser omentum, which is the hepatoduodenal ligament, and 2 fingers can go in. So this is the hepatoduodenal ligament containing the portal triad. You have bile duct, hepatic artery, and portal vein. So what are the boundaries of the epiploic foramen? This is the epiploic foramen, communication between lesser sac behind the stomach and the lesser omentum and the greater sac. So anteriorly, you have hepatoduodenal ligament and the portal triad. As you can see, they are anteriorly located here. They're anterior to the epiploic foramen. Epiploic foramen is where the finger is, so these structures are anterior to it. Then posteriorly, you have inferior vena cava, the crus of the diaphragm. Okay, so posteriorly, you have inferior vena cava. This is showing you, this is posterior, this is anterior. So posteriorly, you have inferior vena cava and crus of the diaphragm that will attach onto the vertebra. And then superiorly, you have the liver, of course, covered with visceral peritoneum. You can see the liver there. Okay. Then inferiorly, you have the first part of the duodenum. So superiorly, you have liver covered by peritoneum. Inferiorly, first part of duodenum. Anteriorly, hepatoduodenal ligament and the portal triad. Then posteriorly, you have inferior vena cava and the crus of the diaphragm. So this omental bursa, the lesser sac, can have fluid. Okay. So how does fluid get there? You can have perforation of the stomach, then fluid enters the lesser sac. So, or you can also have when pancreas is injured or inflamed, then fluid now accumulates in the omental bursa. Now, intestines can also herniate. Remember, there's an epiploic foramen, so they can pass through the epiploic foramen of Whistler, which is omental foramen, and enter the lesser sac. And they can get there, and the edges of the Whistler foramen strangulate these intestines and can lead to gangrene. So that's it about the lecture on peritoneum. So I hope you're okay. You've understood that there's visceral and parietal peritoneum, that we have peritoneal spaces like subhepatic, subphrenic, paraguttal spaces. Then we have omental foramen, omental bursa, which is lesser sac behind the hepatoduodenal ligament, which is the free edge of the lesser sac, and we have, that's where the epiploic foramen is. So it helps to connect lesser sac to greater sac. Then we've also talked about peritoneal modifications like the mesentery, mesocolon. Mesentery is of the small intestine, mesocolon, mesoesophagus, mesogastrium. Then we talked of peritoneal folds like in the anterior lateral abdominal wall, the median fold by the urecas, the medial fold and the lateral fold by inferior epigastric vessels. Then we also talked of peritoneal ligaments, like for the liver, we talked of hepatoduodenal with the portal triad, hepatogastric, okay? Then for the hepatoduodenal, hepatogastric, then remember the triangular coronary ligaments, which form triangular ligaments on the left and right, and falciform that connects the liver to anterior abdominal wall. Then we talked of the stomach having hepatogastric, connecting the stomach to the liver, hepatosplenic, stomach to the spleen, and gastrosplenic, stomach to the spleen, gastrocolic, stomach to the colon. So gastrocolic, gastrosplenic, gastrophrenic to the diaphragm. Then the spleen, you have gastrosplenic, lenorenal, which is splenorenal, and we said the gastrosplenic contains the short gastric artery, while the lenorenal contains the splenic artery. So basically, that's the overview of what we have covered. Bare area is just a place on the organs that is not covered by visceral peritoneum. So that's just basically the recap of what this slide is about. So when you're asked to write an essay on the peritoneum, there's so much to write about. What's the peritoneum, the layers, the cavity, content of the cavity, peritoneal modifications, the species, the applied anatomy aspects, the ligament. There's so much you can write about peritoneum. Thank you.